Hello friends, this is Dr. Ganga, your nephrology educator at PrepLadder. Today let me introduce a new concept to you. Have you heard about the drug called FINERENONE? Well, it sounds a lot like spironolactone, right? That's because it belongs to the same group, that is mineralocorticoid receptor antagonist. Then what is the difference between this FINERENONE and spironolactone? FINERENONE is a non-steroidal mineralocorticoid receptor antagonist, whereas spironolactone is a steroidal mineralocorticoid receptor antagonist. Okay, and FINERENONE has very high affinity, that is, it is highly selective towards the mineralocorticoid receptor. And as an effect of this, it has very high effect on the heart and the kidney also, and it causes less side effects like hyperkalemia. So recently, a trial was done called Fidelio-DKD trial, which showed that FINERENONE in patients with chronic kidney disease because of diabetes, called as diabetic kidney disease, when FINERENONE used in these patients, it led to reduction in progression to ESRD, or there was slow decline in EGFR. Hence, it is now advised that this drug can be used along with AC inhibitors or ARBs along with SGLT2 inhibitors for the management of diabetic kidney disease. Thank you.